So you're welcome to today's meeting. This is Beezers Success in Residency program, which we are creating. We've done a bit of this before, but we want to be more intentional now in terms of once you get matched into residency, what are the things you need to get ready? What are the things that guarantees your success in residency? I mean, it's always exciting to get matched, but how do you get started on the right step when you start in residency? What are the things that, for those that have started residency are about to finish, like one of guests for today, who's about to finish residency this year, I'm sure if he looks back now, starting again, if we were to start from beginning, what will he do differently? And we need to know, okay, how does he run? What is it like to be in residency? What is day to day like? People have sent in so many questions, which are very, very insightful questions, which I think we will gain a lot. So I'm introducing to you today Dr. Nife Balogun, who is an internal medicine resident in Einstein, in Philadelphia. He's a very passionate doctor, and sometimes you feel like he's not so passionate because he's soft-spoken, but he's very passionate about what he does, and he cares deeply for people. And I do not recommend a lot of people a lot of times, but I recommend him strongly because I know he's a very good person. I think it tells a lot about someone that's willing to give back. It's not common. Everybody just wants to focus on their success and move on, which I think I can't blame anybody really. You just want to get going with life, but it's good for him to come back and say, I want to give back. I want to be part of other people's success stories. So this is why we create meetings like this, so that we can all benefit and can all gain the maximum we can, learn from each other. Let's start on a very good note, starting residency. So without much ado, I will hand over the floor to him. He's going to start now. We're going to have a great time. So welcome, Dr. Nife. Thank you for your time today.
Yes, so thank you very much, Dr. Ife Dayo Falabi, for the opportunity. I've known Dr. Ife since when I was in medical school, and then he was very helpful when I was applying for residency within the United States. So it's a very good opportunity for me. I really appreciate it, and I'm happy to be here today too as well. So just like he mentioned, I finished from, he has mentioned some things about me. I finished from Ibadan, the University of Ibadan, College of Medicine, and following which I worked as a medical officer. After doing house job and youth service, I worked as a medical officer for about 2 years, and then I did a little more than 1 year of residency at the University College Hospital, Ibadan, before moving to the United States for a residency. So I'm very glad to be in your midst today. And when I'm done with residency, I'm in third year, I'll be resuming, by God's grace, I'll be resuming gastroenterology fellowship in my program as well. So without much ado, I would like to proceed to our discussion. I was just going to discuss with you about how to be a successful resident, what are the things that one needs to do. And believe me, residency is a marathon, and it's always good to start early and start strong, and it also requires resilience too as well. So these are the things I'll be discussing about. So towards the end, just like Dr. Ife has mentioned, you could ask, there will be room for asking questions. So these are what we'll be discussing about, and also any other thing that may be helpful to you. I would also like to congratulate each and every one of you that are matched. It's not an easy task. You were able to surmount the hurdles, and I'll say big congratulations. So I would start by talking about a few challenges. I believe you would have heard a lot about some of these things, about a lot of things I'll be mentioning today, and there may be one or two that you've not heard about. So I believe that being successful or starting strong starts from the day you match, actually. And then there are certain challenges you may experience, that may contribute to your overall experience, especially prior to starting residency. And these are things like the onboarding and then visas. It's good you do them on time. You try your best to catch up with the deadlines, so that you are not seen as sloppy, and so that in the event that certain things delay your entry into the United States, that's for those who are outside the country, or for those who are already in the country but or require certain documentation. It will be that it's not on your part, because people are actually observing you. And then as we go along, I'll talk about evaluations. So relocation too is a big thing, especially for those who will be coming from outside the country. Accommodation, you want something that is very modest, something, because you'll be earning somewhere between $3,500 to about $4,000. And some people may have families, they may have responsibilities too as well. So you may want to pick an accommodation that is modest. Then you may also look at something that is, like proximity is also very important. Somewhere very close to the hospital, or close to the subway, or close to the bus stop, where you can easily get access to the hospital. Then having a buddy that's like probably somebody who is in the program, who is more senior to you, that has been in the program and understands the program, that will put you through on a lot of things, from the first day to, till you are able to find your feet. It's very, very important. As you go along, you see the importance of having a buddy or somebody you can talk with in the program, because they know the program, they know the environment, they'll be able to guide you through. It's just like standing on the shoulders of giants. It goes a long way. Then mobility too is another thing. Just like I mentioned about the accommodation, you may want, for those who may be in a city or in a town, or in a place where they do not have like the typical inner city transportation, like the subways and bus stops, you may need to get a car. So if you're coming from outside the country, let's say Nigeria, I know certain states, I don't know if it's all states, accept international driver's license for about, let's say, 6 months to a year, thereabout. But one, we need to find out the peculiarity about the state you are going to. So you could obtain that in Nigeria before coming, or from the country you are coming from. Then when you get into the United States, you could also do your license soon after. At least you have something you can work with in the meantime. So like for me, I have not driven for more than 2 years, but as soon as I came into the United States, I got my, I went for my driving test, and I got my driving license, so that I don't forget how to, so I don't forget how to drive and start. I know it's not likely anyway, so but so that's by the way. So we move to the next. So learning, I mean, that's the main reason why one is coming into residency or into training. So most of the headings, I kind of followed the GME competencies. There are about 6 of them, which I will highlight at the end, but I would mention most of them while discussing. So learning is like the main reason why every one of us is, has come for residency in the United States. So and then after that, you can do whatever if whatever goals you have, you can pursue that. So it's very important that one knows that we are all from different backgrounds, and we all have different stories. Like for me, I was, for a little more than a year, I was a resident in Nigeria, and then when I came to the United States, when I resumed in the coronary care unit, and my co-intern was an attending from Brazil. He was an attending anesthesia. He had completed training. And then one of my seniors was an attending from Brazil, an ICU cardiologist too as well. So you see that when coming to the United States, for some of us, we get to meet people from different backgrounds. So in as much as you don't want to compare yourself with other people, it's also good that one knows that we are all starting from the same, we are all given the same opportunity, even though we may have had different backgrounds. And believe me, it was a different experience for them, then that's my co-intern who is an anesthesia attending, and my senior who was a cardiologist and had practiced for years in Brazil before coming to the United States. You know, they were more like into the job than me. They were, you know, Sophia, if there's a word I could use like that. So, but we all have the same opportunity in that we all started from first year in the same United States, and we are all being exposed to the same resources. So I also put there that AMG, IMG, that's the AMG versus IMG. You would also realize that the AMGs are actually on a different, league or section on their own. Let me put it that way, in that they are used to the system. Usually within the first like 1 month, they are able to adapt to the system, and then they are able to adapt to the system within like a month, while the international medical graduate may take like 3 to 6 months, depending on a person, to adapt to the environment. And then one way you can surmount this is by being very proactive. I remember when I came in initially, I was a little bit laid back. Came in straight from Nigeria. I was a little bit laid back, and then one just has to be proactive so that you can learn as much as possible within that time and be able to catch up and be able to meet the required milestones. Because, like I said, the AMGs, like within a month, they are already used, because they are used to the system. So they are already like flowing very well, but the IMG may take a little longer. So don't be discouraged, but just try to be as proactive as possible. Look at the AMGs, learn from them, learn how they are able to navigate the system, how they are able to make use of the electronic medical records, how they are able to work with shortcuts, how they are able to, that proactive, you see it in them a lot. So as an IMG, you have to be on top of it so that within a short while you can catch up. Then there's also the aspect of self-directed learning as well. Ask questions. Don't feel shy to ask questions. It's better to stay out of trouble than to try to get out of trouble. You have seniors that you're working with that you can ask questions. They will be overseeing what you're doing, so you can ask questions for them at least within the first few months. But there's that aspect of self-directed learning. So as you go along, you get to get used to that aspect of self-directed learning, in the sense that, for example, you want to give a particular medication, you would have to learn how to be able to go into certain resources, such as like the UpToDate. If you look at the right corner of the screen, you see EU there. That's a material, an online resource that most of us use. There are also online resources or other resources that are peculiar to your programs too as well. So you go online, you check, so you learn that attribute of being able to look for certain things yourself. So that's that self-directed learning. Because believe me, everybody wants to work with someone who is a self-directed or self-directed learner. So it's a very big thing here. So, but in the interim, while you are starting for those few months, everyone understands. So you ask questions, and if you're not sure about anything, even when you go online and you're still not sure, always ask as well. So, and then, like I mentioned earlier, you learn from others. Then opportunities too that that are available at your program, and other peculiarities of your program. You make the best use of those opportunities. Then you also want to have a study plan too. There's always a difference between the doctor that studies and the doctor who does not study. It usually becomes obvious over time. So you also want to have a study plan. We are just coming in. Like I said, we are all from different backgrounds. My co-intern was an anesthetist. My senior was a cardiologist. So we all have different backgrounds. So the way they would have studied would have been different from the way I would have studied. So you need to come up with a study plan. Generally, I would encourage people to start with the common things, common cases that you get to see. For those who are in internal medicine, things like COPD, asthma, those are common reasons why we admit patients when they come in exacerbation. So you want to start with the common things before you go to the uncommon or things that are not so common. And it's also not good to neglect the things that are not so common, because especially like internal medicine, that's the hallmark of being an internist, in that you are able to identify diseases that are rare too as well. So so there are also very other useful materials, and like I said earlier, it actually starts from before you even start residency. Some people will tell you that, oh, rest, sleep before you come in for residency. Believe me, you're an IMG, so you're in a different category. So I would recommend that you do some revision. For some of us, we've been out of medicine for a long time. We've not practiced medicine. We've been out of the clinical work for a long time. So I put a picture of a book on the right-hand side there. That's the Washington Manual of Medical Therapeutics. Generally, my program director recommends that to people who are coming in. If you could go through it, that would really be nice. And then you could also revise your clinical signs and symptoms, because when you come in, nobody's going to teach you how to examine patients. You get to start the job on day one. You start seeing patients, you start examining, and you start taking, take history and everything. So you want to revise all that too as well. And residency, just like I said, it's a marathon. It's also a steep learning curve. There's a lot that you have to learn within a short while. So as well, so you want to maximize the opportunities that you have. So you don't have to feel like intimidated or feel, don't be discouraged, but it's just knowing a problem. Like it says that a problem is a problem known is a problem half solved. So it's just good to be aware of these things. So I put in there for those who are in internal medicine, there are certain materials that are helpful. We have the mix-up, we have Harrison's, we have Cecil's. Then we have the up-to-date, which is an online resource. A lot of programs will provide you with this when you resume, like the up-to-date, mix-up, and other necessary materials that you would be requiring. So you need your body or your colleague, your senior colleague in the program. Ask them, discuss with them. It's very important. They will let you know what's available and what to expect to as well. So time management is another big thing for the IMG. For me, when I resumed residency, I came in from Nigeria. I really made use of laptops. Most of our documentations were in writing, were not on the computer. So I kind of struggled with the electronic medical record. I was one of the last people to finish their notes, not the last interns to finish their notes. As a matter of fact, my first PD meeting, that was where we discussed. That was why I discussed with my PD. He told me, like the sandwich method. He was like, I heard you know medicine, and he asked me what are the things I need to work on. Of course, I knew, I need to work on my efficiency, especially as regards to writing notes, because it's not something I was used to. So, and that's usually a challenge for most IMGs who come from outside the US, who have not had to work with computer a lot. So right now you can learn how to type. I put a website there, typing.com. They have a free package there where you can learn how to type. Then we also have dictation softwares too. Most programs have dictation softwares where you can dictate into a device. You don't have to type, but there are sometimes that you may have to type. So it's just good to be up and doing and proactive about it. So, but I mean, within a short while, I was able to, like for most IMGs, we're usually able to catch up. So don't be discouraged. Just be proactive about it within the first few months. So know about each rotation before starting. It should not be that it's on the morning of that rotation. For example, you are supposed to resume the general medical floor. So it's not that morning that you want to know that, oh, this is what is expected of me. So here again, discuss with your body. Discuss with them, ask them about the rotation. They will tell you what the things to expect, what are the things to do before that morning, and then try to start your day early. Like I said, for most of us IMDs, when we first resume, we usually have challenges with efficiency. You may not be like the American medical graduate that will resume work at 7 a.m. because if work starts at 7 a.m., they may resume at 7 a.m. They are used to the system, but you are not so used to the system. So you may have to resume your work earlier, maybe like 6 a.m. You may start charting and reviewing patients' cases. Then, you could even start writing your notes. You could have even seen your patients. And then, so that you are able to be abreast with what's going on with everyone on the team. So, medical knowledge, I put it there. And that still takes us back to the previous slide too as well. You need to have that study plan, because the more knowledge you have, you are likely to be faster with whatever you're doing, because you easily be able to come up with differential diagnosis. You're able to move quick. You know what to do, and it's a skill you get. That acumen, it comes over time. You get to have this over time. So don't be discouraged when you first start and it looks like everything is a little like fuzzy. It's not so clear. As you develop yourself, you see that you keep getting better and better. So it's just having the right mindset. That's the most important thing. Then balancing patient care and learning. So it still boils down to that aspect of self-development. So while you're also caring for patients, you also want to be sure that you are meeting up with your own milestones. You don't want to spend the whole time in the hospital and then get back home, sleep, and return the next morning. So of course, there are rotations that will be very busy where you may actually fall into that. But one requires that consistency in learning, being able to strike that good balance. So as well, communication skills is very important. When I came to the US, I know you can still see that I have my accent. It was very difficult for me. Half of the things I heard, half of the things my colleagues, the who were Americans, said, I probably would not hear. But it's medical jargon, so I was able to catch up. I was able to understand what they were saying. So over time, it gets better. You get to hear them better and better. And then you also have to learn ways to be able to communicate with nurses too as well, and even patients too, because some of them would not hear, especially for the IMG who has an accent. I beg your pardon my use of accent. So a lot of times when you're getting the patient from, sometimes they may not hear you very well. So you may need to pay attention to certain cues from the patient so that if you need to repeat yourself, then you repeat yourself. And then also, a lot of times you could also let the patient know that in the event that they don't hear you properly, they could let you know so you can go over it again. And a lot of times give them your bio, let them know who you are, let them know where you're from. It goes a long way too as well. Then communication with family too is very important, especially at the bedside, via phone. It's very, very important, especially in the ICU and then other places like the progressive care unit or the high dependency unit. So it's something that we struggle with as IMGs, but it gets better. You get to learn this over time and time. With time, and then you look at the American medical graduates, and you also learn from them to how to go about this too. So teamwork is very it's also very important too. At the workstation, there are certain things that you could do. It could be your co-intern who is struggling with one or two things. You could be of help to them. You may want to go and get a cup of coffee. You could also ask other people if you could get a cup of coffee for them. These are the things they really like, and then it goes a long way. Working closely with the team, attending codes. If there are codes like a patient suffers a cardiac arrest, it's always good to go there. You could assist with chest compressions. You pay attention to what's going on, because that's the way you will learn. You pay attention to how it's being run, the thought process, and then because in a few months, time to a year, you'll become a senior as well, and you'll be heading the team. You'll be more responsible. So it goes a long way as well, and people are observing you too if you're a good team player actually. So professionalism is very important. So you want to be very accountable. You want to be accountable. You want to be seen to have integrity. You don't want to be the type that will go and listen to the chest of a patient who is wheezing, and then and when you're presenting your patient to the attending, you're saying something different. So you want to be accountable. You want integrity, because some of them will actually examine at the bedside too as well. So you don't want to be seen as not having integrity. So you also want to prioritize patient care. If anything is happening with your patient, be prompt. The nurse would alert you. Be prompt. Be at the bedside as soon as possible, because some of them actually document in their notes what happened. They will document the time and if the doctor came around or not. So you want to prioritize patient care, and then overall you want to put your best foot forward. I mentioned about punctuality earlier, and then try as much as possible to know your patients very well, because you'll be presenting patients to the attending, especially as a first year, and throughout residency too as well. But most of the time, the first year does a lot of presentation. So you present to the attending, so you want to know your patient very well, and then you want to be accountable. Confidentiality too is very important. There's what we call like has to do with like the HIPAA rules, things that have to do with patient privacy. I know of a resident who went and opened the chart of an attendee, and the resident was almost sent out of residency. So if you are not in direct care of a particular patient, you don't want to be opening people's chart. Anything that doesn't really concern you, or any patient that are not directly caring about, it's good as much as possible you try to avoid opening the patient's notes or chart. And if you have any issues or any problems or any conflicts, it's always good to report to the appropriate quarters. You could inform the senior, you could inform your attending, or if it's with the nurse, you could inform the charge nurse or the head nurse, rather than getting into exchanging words. Then documentation too is very important. Like I generally said, whatever you document is what you've done. So documentation is very important. So always really document appropriately what happened, and then respect and cordiality too is very important. Attitude, because you will be evaluated. People are observing you, and you also evaluate other people too as well. I remember one of my attendings mentioned to me, said attitude is everything. So they actually pay attention to this. Then self-care is very important. It's very easy to get burnt out. Residency can be demanding. So you always want to make out time to rest. You always want to make out time to rest, exercise. Exercise helps a lot of people to cope with stress too, as well, maybe because of the release of the endorphins and the other molecules as well. So people like kind of feel some relief when they exercise. Gatherings too are very important. Get-togethers, hang out with your friends in the program and then in the community too, as well. For those people who are like spiritual, you get meet people in the church. You get, most cities have that African community. Even in your program too, you could have like your fellow Nigerians or Africans. You could organize get-togethers. Yeah, so this helps a lot. Then imposter syndrome is another thing so that happens to a good number of people. It happened to me once, almost like it, where I just felt like I was not a doctor. I think I felt it once, like it was very brief though. I just had a very rough day that day, and then so how did I get over it? I mean, I just have to remind myself who I am, and then remember the times you've been good. Remember, having to do things like gratitude. You could actually have to talk with someone. I think that day, so I called one of my friends, and just discuss what happened, and then I was really encouraged. Yeah, and then there are numerous resources in the event that you feel down. Most programs have numerous resources that could help you either online. So you just need to speak with your body or people, at your program to know what's available. So feedback and evaluation. So you get evaluated. So just the way you also get evaluated, you also evaluate other people too, as well. So remember that you are here you're coming to learn. So take it easy on yourself, and then as much as possible, you want to be as good as you can be. You want to put your best foot forward. People will give you constructive criticism. Just like I mentioned, like within the first few weeks or months that I resumed, I had a meeting with my program director, and then we discussed about how I could be more efficient, and so that's constructive. So you get to see things like that, and then be ready to let go, because sometimes you may have one or two people that may not approach you the way you expect to be, but just be ready to let go. It's just human. And then you also evaluate other people too as well. In fact, when I resumed, I didn't know that I was going to be evaluated. So like, I think it was just after 2 weeks I received the notification, that I was going to evaluate the seniors I worked with on my first rotation. I was surprised. So it means I was going to be evaluated. So it was interesting. So life after, I was just going to mention briefly about life after residency and fellowship. It actually starts before you come in, actually. And then within your first few months as a resident, I know you like your first 3 to 6 months generally, you may want to focus on the residency itself, get used to the system, get acclimatized. So I would say that after 6 months, it's good you start thinking about what, in fact, within like 3 months, to be honest, start thinking about what you want to do. Because the time goes really fast. It goes really fast. Before you know it, you're in second year. And if you're not going to be a fourth year chief, by the end of second year, you're applying for fellowship. Or if you're going to be on if you're on a J visa, you're going to do your J waiver, towards the end of second year, you start looking at that. And before you know it, first year is over. And these things just don't come on you. So it's good you know early what you want to do. And if you don't know, it's fine. You could take about 6 months, 7, 8 months, but don't allow it to be too long, so that if there are things you need to do, or if there's anything you need to put in place, you could do that. So one thing I would advise, generally, especially for those people who will be going into fellowships, most fellowships, they always want to see that you have some form of research or scholarly activity. So I advise you to find out from your body and from your program about the IRB training. It's good you do it on time, so that when opportunity for research comes up, you can join such groups or join such participate in such opportunities. Because there's a saying that is it fortune or favors the prepared or something. There's a way it said. So you need to be prepared. So you need to have done the IRB training, so that if there's anyone who is doing something, and you can easily hop on their project. And you don't have to be the one to do all the projects. You can have 1 or 2 projects that you're doing personally, and then you can collaborate with other people, and then before you know it, by the time you're in your second year, you have a lot on your profile. So scholarly activity is very important. It could be in form of articles, various publications. It could be like systematic reviews, but it just depends on whatever you're able to do. Then away rotations, generally it's always good to start on time. For some people, they may be in community programs, and you may be thinking of going into like a competitive specialty such as cardiology or gastroenterology, or hematology, oncology, or depending on whatever specialty you are in. So you may want to start the process early, because it takes some time. Sometimes they may want you to get certain documentation. It may involve a lawyer, especially if you're on a visa. So you may want to start this towards the end of your first year into your second year, because before you know it, by the end of your second year, you're applying for a fellowship. So you want to do this on time, because it gives you the opportunity to be able to work with attendings in that field you're looking to go into in other centers. And those attendings will also be very influential, or instrumental in probably writing you letters of recommendations, or as much as possible, or even going to the extent of putting in a word for you at programs. So it's always good you start these things early. Then for those who are on visas, generally, especially for competitive specialties, the H-1B, it can be a little difficult to get into those competitive specialties on H-1B visa. So as soon as you come in, it's always good you find out what are the options, what are the things that you can do. For example, some people may have even had like master's, PhD in the past. You could leverage on this, apply for the EB2 or the national interest waiver, so that you can easily get your permanent residence as soon as possible. And then by the time you're finishing, if it's possible, you'll be applying with permanent residence, which is easier. So otherwise, you may need to probably do a chief year, work towards doing a chief year, or do an extensive scholarly activity, such that it will increase your chances of matching into such fellowships. Then those who are on the they're almost like you know, permanent residents. It's easier for them to get into uh, competitive fellowships too. So I mentioned the EB2, so that's the NIW pathway too as well. Then having a good name, I mentioned a lot about you know, professionalism, work ethics, and then being on top of your game. So if you have a good name, it goes a long way too as well in contributing to increasing your chances of matching into a fellowship, competitive fellowship, because you have like good letters of recommendations. People will be able to put in a word for you as well. Then I was going to mention briefly, I know my time is fast spent, but I'm almost done. I was going to mention about some things that may bother us before we come in. You must have heard of things like in-training exam. Is that exam that assesses how, well, like for those who are coming in for the first time, it assesses your baseline, then you do it the second year, you do your third year, it kind of assesses your progress over time. So it's always good if you start out well. Ideally, when you're coming in, you should assess your baseline, but believe me, your colleagues will prepare for this exam. They will raise the bar, so you have to prepare for the exam too as well. So common for like those who are in internal medicine, there's the board basics mix-up that you could use. You also have question banks too, like the mix-up, question bank, the NEGM, Q bank too as well, depending on which one you're able to lay out. But I know a lot of people, like for the internal medicine, recommend this board basic mix-up. So if you look at the right hand corner, I kind of put like the content area that has the highest questions. Like you see, cardiology is one of them, hematology, oncology, is one of them, and then pulmonary and critical care is one of them. So like if you're the laid back type like me, I may not be able to like go through the board basics. I may not, So I'd rather just probably solve some questions on like the highest yield ones, the ones that have the highest number of questions. So it's just good to do some preparations because you have a lot to learn, you have a lot to do. It may look like a lot, so sometimes you may just want to strategize in the event that you're not able to like meet up with everything. So USMLE step 3, some people may have to take it, like those who have not taken it, you may have to take it within the course of your program. So you may need to find out from your program how soon. Some programs, how soon they expect you to take it. Some programs will require you to take it within the first year. Some maybe like the December of the second year, So, but generally, I think the rule is that by second year you should have taken it. But each program has their peculiarity. Like my program, they want you to take it within your first year, preferably before March, March, April of your first year. So and then basically the step 3, mostly MCQs and then clinical cases. As you go, for those who have not taken it, as you go along within your first 3 to 6 months, the training will actually help you with the clinical cases as well. So there's objective structured clinical exams that you may do from time to time during the training. I didn't get to do most of the OSCE because of the COVID, but I know programs have started doing it again. Then board exams, that's usually following completion of your residency. So these are the 6 ACGME core competencies. I kind of dwelled on them as we went along. So, so I'm just going to leave you with this from Harrison's Principles of Internal Medicine. No greater opportunity, responsibility, or obligation can fall to the lot of a human being than to become a physician. In the care of the suffering, the physician needs technical skill, scientific knowledge, and human understanding. Fact, sympathy, and understanding are expected of the physician, but the patient is no more collection of symptoms, signs, disordered functions, damaged organs, and disturbed emotions. The patient is human, fearful, and hopeful, seeking a relief, help, and reassurance. So it's just good that we have this at the back of our minds as physicians while we care for patients, seeing them beyond mere cases. So thank you very much.
Oh, thank you so much. That's been very, very insightful. Thank you so much for sharing. That's like a lot to take in, and I'm sure everybody has got one or two things from that conversation we just had. I think it's very insightful the way you went about it. It made it very interactive and practical to say, okay. And I'm sure for those that are starting very soon now, the fear of starting, at least you've taken a bit of the edge off that. Thank you so much. So we have some questions already for you. I know some people might have some questions online. So you can put that in the chat button. We'll get to it, but we'll start with the questions we have from the form we sent out earlier. So one of the first questions I wanted to ask you is this, is in terms of work-life balance, what's the average time you're going to be at work as a resident? How many hours in a week? How many nights do you do? And how do you reckon one starts balancing that time in terms of maintaining that work-life balance and not getting burnt out?
Yeah, thank you very much for this question. And before I proceed, I would like to, I know I mentioned a lot. I don't want anyone to feel discouraged. I mean, it's just good to know what to expect. And then, and there's still a lot I'd have loved to mention, but I know time would not permit. So, and then you have what it takes. Believe me, you have what it takes. It's in you. It's just that you just need to show it. And then, like I said earlier, problem known is a problem half solved. So it's just good you know about these things. So you don't want to go through what some of us went through. You don't want to make the mistakes I made too as well. So going to this question, thank you. It's a very good question. So generally, it depends on the program. Like the ACGME does not expect you to work more than 80 hours a week. And I know for my program, a lot of times you don't exceed more than 50 to 60 hours a week, really. So then I think there was another part of the question too as well. Dr. Fefis, can you remind me? Sorry.
So it's about nights. How many nights you do in a month? And yeah.
Yeah, so thank you very much. So it depends on the program too as well. Some programs don't, you know, they probably do 24-hour calls. Some programs do what we call a night float. Like my program, we do what is called a night float. In that somebody comes, you know, we have the night team, they start work at 7 p.m. and then by 7 a.m. the day team takes over. So I like we get to do like, let's say maybe 6 to 8 weeks of nights. It depends on the year you are in, you know, and the responsibilities. So we tend to do like 6 to 8 weeks of nights, you know, and it varies from program to program because some programs have like my program, we have a large number of residents, about 30 residents in internal medicine, for example, in each year. So you're likely to do fewer nights if you're more, and then if you're fewer, you know, so it just varies from program to program. So I wouldn't say there's a hard and fast rule about it. And then, like I said, some programs do 24-hour calls or duty. So it does vary. Some of them, it does be in a particular service. Like I know some people, in some programs in the ICU, that's where they do 24 hours. You know, but my program, we just have rolling. We don't do 24-hour duty. We do like 12 hours maximum. So I don't know if I hope I answered your question.
Yes, you did. Yes, you did. Then the other question that is coming up also is you started mentioning it actually. You talked about visas. Some people, you know, earlier I think was last year, there's a lot of noise about J1 waivers being blocked by the government. There's a lot of noise about that. How do you navigate a J1 visa? And as you said, a J1 visa is even better for you in terms of getting a competitive fellowship. And some people say, okay, you need an H1 to get permanent residency is faster on the H1 pathway. And now there's the EB2 pathway also. So how do you navigate this as a resident? I think most residents are already coming in with J1, some with H1. How do you navigate the visas, switching from J1 to the next until you get to permanent residency? How do you navigate that?
Yeah, thank you very much. That's a good question too. So for the J1, so usually, like it's another name for it is the exchange visitor visa, so a professional visa. So like when you're done with your training, you are expected to either go to your home country for 2 years, or you do the waiver and work in an underserved community for 3 years. And when they say underserved community, it just means that that community needs more attention, like medical care. So it does not necessarily mean that that community is like a rural community. Some of them may be rural, but not all. Like a good number of them are like cities, but it's just that they do not have enough maybe doctors or healthcare service. So a lot of times from your second year, towards the end of your second year, if you're not going for fellowship, you start early. There are about 3 pathways for the J1 visa. I may not be able to go into too much detail about it, but I know one popular one is the Conrad. Usually you have like about 30 slots like for each state thereabout, and then there are like ways to go about it. I could send Dr. Ife some materials that could help you understand the waiver pathway if you are interested. So a lot of people who come on the J eventually enter into the waiver pathway, and it's rare to hear most people that go back to their home country. A lot of people actually, because the US also needs healthcare personnel, so a lot of people actually go into the waiver pathway. And once you get a hospital that is willing to help you with the waiver, they put you on an H-1B waiver, and then usually it may take about 3 to 5 years, and then you eventually, before you get your application for the permanent residence may get approved. So it just depends, it varies. And then for the H-1B, usually they can start applying for the permanent residence soon after they can't get into the system. They get into the residency. It's possible, but it's just that a lot of times you may require certain things. It just depends on what you have on your profile. For some people, you may require some like research. So I've done some research to be able to enter into that EB2 pathway. So so there are like a lot of times you may just have to find out based on what you have, and a lot of times it requires like an immigration lawyer and things like that, both for the H-1B and for the when you're doing your J waiver. So it's a little bit not so straightforward procedure. So I could send like a material from the American College of Physicians to Dr. Ife. So anyone who is like interested in understanding better, especially the J waiver pathway, you could look through the videos or materials. They're really helpful.
Thank you so much. I think that's very, very helpful. Now, in terms of research, getting like an additional degree, like a master's or PhD in the course of residency training, is that practical or is it possible?
Yeah, so I know I've heard of a few people. In fact, I have like a colleague in my program who, alongside while we were resident, we are the same set. He's also a Nigerian, so he was doing his master's in public health. So at the same time, so he was doing an extended program, maybe about 2 or 3 years, not the accelerated 1-year program, because that's almost impossible to combine with residency. So he was doing that, and I know he's been able to complete it probably over 3 years. So it's actually possible to do. I know like MPH, I'm not very sure of a PhD. I know like master's it's possible. And then it depends on the program too. There are some programs too that kind of incorporate these things, especially the university programs. But I'm aware of this at the fellowship level. Because like when I interviewed, I joined the meet and greet sometimes for fellowship. I remember this program, Cornell. So the program director mentioned it that for fellows, within the, during that time, you're expected to complete a master's program. It's good if you, so it's a combined program. So for some, it may be a combined program. So you may just need to find out what is available in your program. You could discuss with your program director about it, or any helpful person or whoever is handling such office in your program. Then I know there may be peculiarities about those on like J visa. Like those on J visa, yeah, like for what we call moonlighting or like some gainful employment, you're not expected to participate in that. You're expected to focus on your residency training. While those on maybe like permanent residence and they may be able to juggle other things alongside. So I think the most important thing is when you get in, find out from your program, especially your program director, what are the things that you can do. So I think that's it. But I know it's doable depending on what you're on and depending on what's available in your program.
I think you've been very, very practical with it, and you've addressed it actually. The other thing I just wanted to round up on, you said the average salary, if you expect to go on with, is about 3,000 to 3,500.
It depends on program. Like I think it's like 3,500 to like maybe 3,400, 3,500 to like 4,000.
Okay, so $3,500 to $4,000.
Yeah, it varies from state to state. I know they increased it a little bit last year, so my figures may not be exactly correct. It may be a little more than that. Yeah, so but that's it on average, because certain states are more expensive. For example, you're in Boston, you are likely to earn more than the person who is in maybe like Texas or maybe Philadelphia, Pennsylvania, because things are more expensive in Boston. So there's just a way they try to balance it. So, but the difference is not so much. Probably the person in Boston may be earning like 3,900. The person in maybe Pennsylvania may be earning like 3,500 or 3,600. So, yeah. So there are just these subtle differences from state to state.
And how do you manage finances? You've mentioned very, very good point actually about ensuring that your accommodation is not too far from the hospital, is close to the subway, close to the transport and all that. But how do you manage your finances, loans, mortgage, and car purchase and things like that, so that you don't have a huge debt at the end of residency?
Yeah, so I may not be the greatest on maybe when it comes to finance, but I would say that the US is such that anything you do not need, you are better off not getting it. For example, in Nigeria, it may be easy for you to stay in a 2-bedroom apartment. You can easily fund it. But within the US, it's better. If you can stay in a one bedroom, maybe like a room and parlor, or a studio, if you're alone, But if you have a family, then you may need a 2-bedroom, depending on your taste. But whatever you do not need, it's better as much as possible not to get it. For a car, for instance, if you're in an inner city where you have a very good rail network or a subway or a good bus system, and you may not need a car, you're better off not getting a car, because if you get a car, one, you're going to buy the car, you'll be paying loans on the car. Two is that you pay for insurance monthly, which can vary from like $100 to $200 depending on whatever package you are on. Then there are other bills that you keep accruing. So if you actually do not need it, you rather use the subway. So, but for some people, you may not be able to do without the car because you need to get to work early. There is not a very good transport system in the city, like maybe like a good network, like a real network. So you may need a car, so that's fine. Then you have to get one. So so you just have to, like, whatever you do not need, as much as possible, you don't want to get it, and then you will want to live close by to maybe like a bus stop or like a subway. It's always good you discuss with your buddy in the program or anybody, any of your senior colleagues in the program, that they can put you through on how to make the best use of the environment, and things that you need and things that you do not need. Yeah.
Thank you so much. I think what you said about what you don't need, don't buy. It's very, very critical. I mean, if you don't need it, don't put on a loan. Don't put unnecessary burden on yourself. I think that's very, very important. Okay. Yes.
Yeah, so I was going to say another thing that may be helpful. Maybe things like credit cards. Sometimes they may be helpful.
Okay.
Especially if you're coming in and maybe like eventually you're gonna have to like maybe buy a car later on, or buy a house, going to some mortgage, because they look at your credit score, and
Okay.
then they use that to give you loans and things like that. So sometimes it may be helpful. Some people discourage the use of credit card, but I mean that's the benefit of a credit card. They look at your credit score, what it's like, how you've been able to pay back your over time, and then they are able to give you certain loans for certain things that you may need. So those are things to also pay attention to. You just try to learn more about it.
At least you should build up your credit history gradually, at least.
Yeah, so that's it. Building a credit history is also like important, especially if you may have to do some like expenses later on.
No, thank you so much, Dr. Nife. Thank you for your time and thank you for doing this. This has been very helpful.
So thank you so much for having me. I appreciate it.
Okay, thank you so much, Dr. Stella. It's good to have you today. And she's had a very, very interesting journey to becoming a resident and very, very inspiring. Very inspiring. She's been very, very focused and dogged, overcoming of the obstacles in Nigeria, and she finally got neurology. And so she's going to PGY3 later this year. So I think our program is a 4-year course. So I'm looking forward to becoming a chief resident. So she's always very ready to help, and anytime we reach out to her. And I think one of the I think Dr. Uzoma got matched this year, and she said you inspired her with your when you got matched, your video inspired her, and so she's also matched this year, and she's also listening to your video again. So I like that continuous mentorship circle. So thank you for being available to do this. And okay, you have the floor now.
Always a pleasure. Good day, everyone. I'm Stella. I'm Nigerian, finished from Obafemi Awolowo University, did my public health residency in Federal Teaching Hospital in Ido-Ekiti, became like part 1, part 2 before deciding that I want to transition to the United States for my residency. Also did like PLAB, I did PLAB 1, so I was having like multiple options in order to like leave when I decided that that is what I want to go ahead with. So congratulations on matching. I know it's not easy getting this far, but you've made it this far. You know what works well for you. So what we're going to do is more like an icing on the cake, because I wouldn't want you to stop what you're doing if it's actually working and has bring you this far. So that's what I would try to say. But if there's any particular question that I may talk about, I'll be willing to expatiate more on that. Do you want me to take the questions, the ones you asked me about the residents, how to transition the intern year?
I think first, just to say, like, if you were starting residency now, based on all you know so far, what will you do differently? And what will you advise? What are the pitfalls you advise people that are starting residency to avoid? I mean, relocating to a new place, acclimate, and hitting the ground running, because as Dr. Nife said earlier, it's like they're not waiting for you. It's not like school again. They're not waiting for you to start saying, okay, how do you do this? How do you do that? They expect you to hit the ground running, start clocking patients, start examining, start presenting. As an IMG, how do you prepare for that?
Yeah.
Like starting this July, how do you prepare your mind, getting ready? What are the things you need to do?
Yeah. So it varies. That's one for sure. If you're someone that is in America, even if you're an IMG still have like different categories. If you're someone that is in America, you've gone through like so many observerships, you've seen how they do things, you have that experience, that's okay. You're kind of more privileged compared to someone that is coming all the way from Nigeria. So if you're coming from Nigeria like myself, you're like basic. I didn't have any US clinical experience. when I was coming. So I was green. Oh, I was blank. Let me use that word. So that situation is quite different because I just came in and we're just thrown into the field like you have the experience. But having those background clinical knowledge in Nigeria was very helpful. So most people will say, don't prepare, this is the time for you to relax. This worked well for especially the AMGs, the American trained graduates, but for us like IMGs, you need to know what to do. So I remember when I came in, the first thing I did was to see someone that was in the program. I tried to reach out to as much as all the Nigerians in the program. Try to introduce myself to them because, you need somebody in the program like to be your friend or somebody you can look up to. You walk around the corridor, you see them, and not when you just, oh, you're Nigerian. If you reach out first, it's good. They may not say anything, but don't take no for an answer. Don't feel like, oh, this person did not respond very well. That person may not respond very well today, tomorrow, and that person will be your best allies or your best buddies. So try to reach out to Nigerian in the program. Don't limit it to Nigeria. That's one thing too. Whoever you see in the program that you think you can actually bond with, try to take the initiative, go in. So, and the second thing I will talk about is the job itself. The EMR is very important. When I came in, the first thing I did was like, what am I going to be doing? I'm going to be typing. In Nigeria, we write notes on paper. So now this is a lot of typing, a lot of jargon, which I wasn't very exposed to. And we use Stella in our center, more like ACES, unlike so many places that use Epic. So I have to go and meet somebody in her house. Normally they do the training for you. You get the training. You'll be trained on how to use it. But if you don't have like hands-on experience, the formal training without practice, you won't be able to like know what to do fast. So try to know the EMR, which is very, very important. So get as much help as you can. One thing that I will talk about, your clinical knowledge is important. So I like classifying things into different things. Your personality is important, and your ethics, your work ethics is also very important. So what I mean by work ethics means punctuality, coming to work punctual. Someone is going to be there overnight. You're going to take over from someone in the morning, and you come late. Imagine you working overnight and someone coming late. How do you feel? The person is tired, wants to leave. And if you keep that pattern and everybody knows you for that pattern, that's not a good working ethics for a start. So punctuality is very, very important. Your work ethics, be respectful, be kind to people you work with. Try to smile. I'm not a very smiling person, but I'm learning to do that more often now, like smile. People want to see someone that is more relaxed, they can talk to. So your personality, your work ethics is very important. Your personality, you should be a loving person, someone that they can actually reach out to, not someone that people are like very scared to talk to. Maybe they put you in a rotation with someone because you're going to work with different people. You're going to work with different seniors, and they talk a lot. Like they say, oh, are you working with Stella? Oh, gosh, it's going to be a boring week. You know that is not a good sign, right? And you don't want to do that. You want your personality to be someone that even if they find happy to work with you, you're going to contribute to the program, to the rotation that week they are working with you. So have a very good personality. Try to smile, try to help out. That will help you. Then your clinical knowledge. You've come all the way. You're here now. So you know what works for you, how you wrote your step 1, step 2, and everything. Now is for you to practice medicine, to work as in do medicine. So you need to sharpen your knowledge, like whatever you don't know. When I started initially, I was asking questions, which was not nice. Because I have my phone. I have so many up-to-date is there. I can easily check. So it's good. What you check on the phone is different from practical sometimes, but try to have a basics. Don't be, oh, what is the patient having? What do we do now? No, that's not a good thing. You should know, oh, ABC of resuscitation, you know, like the airways, the breathing, the circulation. Those are like basics. So even if you don't do anything and you just say, oh, the nurse, can you do this? Can we get the blood sugar? It means you're doing something even before someone comes in, right? And you can quickly check on your phone, even before asking questions. So try to sharpen your knowledge in terms of knowing what to, even the EMR we are talking about. There are so many videos on training on YouTube that can help you on how to go about navigating the EMR. So, and try to also look for resources. I'm going to say a lot of things like do this, but in all, you can pick one or two that works for you better kind of picture. That's what I would say. If you know, like me, I like watching videos. I learn more with videos, especially if I'm going to, because it makes me sit at a point, like see things. Sometimes when I'm tired in between reading, I want to watch videos because videos keep me glued. Unlike just reading and getting wiped out, forgetting what I'm reading, I can watch videos. I remember what I see more. I remember what I read less. So it depends on what works for you. So I would say coming into residency, I know people, Nife might have spoken a lot about so many things, but for me, being a female, I knew also that appearance also matters. Like, don't be so, like your personality I talk about, be clean, don't be so untidy or unkept. That's the word I can use. Your scrubs should not be so rumpled as if you just picked it from the garbage and you're coming to work. So you want to look like, presentable. Myself, when I started it, the scrub they gave to us, I didn't really like it at first, but with time I started getting better scrubs, and I was using those scrubs. Like, my appearance was, I'm very punctual. I try to, if I'm supposed to take sign out at 7, I try to get there before a 10 minutes grace before sign out. That's one, punctuality. Then appearance, I try to be very clean. You won't say, oh, I won't sit with this person because you don't know, for sure. So I try to be very clean, make yourself clean. Don't have things that make people run away from you. So your personality, your clinical skills, you're going to learn a lot. You're going to learn. So don't feel like you don't know anything. You do know a lot for you to get to where you are. So the preparation for residency is quite different from the preparation for the exam, the steps. So you learn a lot depending on your program and depending on the didactics you have. And if you see something that you want them to inculcate, you can speak out. You can tell the chief, like, oh, I think we should do more of simulation. I think we should do more of practical things rather than, So you can actually do something too. And don't be like, feel shy to speak out or say something that you see that can be changed. So be that change too. And we Nigerians, we are in a program. I keep telling people I want more Nigeria in my program, because when I applied to my program, I was like, I didn't see any black in even the profile, the faculties and the residents there. I was like, what are my chances? The odds are there. So some program wants you to be there because of it. They talk about diversity and stuff like that, which is very good for the program. So if you get yourself in that program, try to prove that you're worth taking a risk for, and you can be open more doors for people from that particular group. Like, if I'm a Nigerian and I'm doing very well, they'll want to take more Nigerians. They'll say, oh, Nigerians are very hardworking, they're very cautious. I think we should have more, and the probability of them ranking Nigerians higher is going to be. But if you come and you did not do very well, they'll be like, the Nigerian we have, she didn't pass the board, she didn't do this. So you may also block other people from coming too. So it's both ways. But I would like to address if there's any particular direct question, because I'm just saying so many things and I don't really know what you want.
Yes, I'll prompt you. There's a question actually that I have here, and the question is, what are the potential options for an aspiring neurologist who marched into preliminary but no advanced neurology program? Do you have any ideas now to make the best of the situation to secure a neurology program after the preliminary year?
So I get the question. The person matched into the first year, but does not have continuation of the advanced program attached.
Yes.
So I would say, based on my limited knowledge, because I will not be like the best to answer this question because I didn't go through that route. I actually matched into like complete match, in which you did I'll do my prelim year in the program in internal medicine and continue the rest of the advanced program in the same program, but this time in neurology. So after the prelim year, they give you a certificate, like we completed that prelim year. Then the same program, so I wasn't like moving from one state to another or changing apartments, just continuity. So, but if you find yourself having just the prelim year, but you don't have the advanced program attached to it, so many things I believe you can do to help you get the continuation aspects in neurology would include things like reaching out to programs. So you can actually research the programs you want to go into and reach out to programs. Some programs have opening for PGY2 because some people pull out, or some people, life happens to people, you understand. So when life happens and they have like a vacancy, they may want to pick in people to fill in that spot because they already have money allocated or budgeted for that spot for the rest of the persons, and something happened, the person did not continue the program. So reach out to programs, which is something you can do. Then if you have the opportunity to attend conferences during your first year, in that specialty you want to continue, like if you want to do neurology and they have AAN, go for AAN conference. There you can network to so many people and you tell them what you're actually looking for. You will see lots of programs having stands there and trying to sell their program to you. So you can tell them, oh, I but I don't have where to continue my program. And they, oh, I know a program. They can just link you up. You know, that is physical. It's so informal, and you get lots of things for free by attending those conferences. Then there are some other places you can actually ask questions. Recently, I started using Read It more, and formerly I was using Quora when I was in Nigeria. So those are great platforms, and there are some other Facebook. Facebook is like a very big thing, but you just need to know how to use it. Most programs are on Facebook, they are on Instagram, but you won't follow them because they are not posting so many things that. But if you dedicate and go after them and ask questions and direct things like that, you can actually get. So by going through those other platforms, really asking those questions, people will just answer you generally because they don't have a face. They put different names there so they can say whatever they want to say. They are free. So attending those programs can actually help you to reach out to people. So the most important thing is still reaching out to people, and they will tell you they have an opening, and you can come in and fill it. Okay? So it's something that is doable. Don't let that discourage you. But if you are in that particular situation, if you don't mind having multiple programs you want to apply to, okay, maybe you want to apply to neurology, PGY2, you want to apply to other programs that need prelim year, like radiology, dermatology, PMNR. So those programs that you don't need to do PGY1, but because psychiatry, you don't need 1 year of prelim, so you can't jump that step. So if you want to apply to multiple programs that have prelim year, that would be also a very good idea because that increases your chances, you know, of getting from different specialties. That's if you don't mind. But if you really say, this is what I want, and so you focus on that aspect, it's doable. Very, very doable. That's what
in terms of in residency training and exams preparing, and also balancing your work. How does that, what's the best way to approach that with preparing for exams, evaluations, ensuring you're also taking care of yourself and not get burnt out? How do you manage that?
Well, first year is very tasky and very it's like the one of the toughest, let me use that word. So when I came in, first year for me, I came like, I was in Canada briefly, but it was as if I wasn't working as a doctor in Canada. I came here, I spent like 7 or 8 months in Canada before coming. So it was like I'm from Nigeria, kind of. So when I got here, that first year, I already knew from so many people that it's going to be a bit challenging. Knowing that I'm a mom, I have 2 kids, and my husband is also with me here. So balancing having them to go to school, having to wake up so early and leave the home can be quite challenging, but it's doable. People do it. So one thing that can help you is when you see your schedule, try to study your schedule, because look at the places you have like more free time, and maybe those periods you can plan family things around those events. In terms of reading, PGY1, I didn't read much because it was more like internal medicine. So I had like more of inpatient jobs to do, like trying to finish my notes, trying to know the EMR very well, because that's like the basic for me to know medicine before coming over to neurology. So I tried to do more of skills, like how to do POCUS, bedside POCUS exam, even if I may not do that long run, but at least to know what I'm going to look for in the POCUS if the patient is dry or stuff like that. So that PGY1 is mainly can be very tasky, like you have so many tasks to do, but you just have to balance it. And in terms of reading, I would say there are so many resources here. In terms of resources, you will get a lot of resources, it depends on the program, but my program, PGY1, they made available to us up to date, which was very good. So it's on my phone. I can actually just click on anything and, get information on the treatment of any situation or any condition, medical condition I'm not so clear about, which is very good. So if try to read on the go, create out time. It will be very difficult, but I think it's doable. You can create out time of, once you see a patient, maybe you see a patient with UTI, you can just go through the UTI algorithm on how to treat symptomatic UTI, asymptomatic bacteriuria, and the one from pregnant women. You can see the algorithm and the common antibiotic profile that you can use for that situation. Most hospitals have like their bacteriogram, in which like the common sensitive organism that they've been using for this particular infection, that is very helpful. So creating out time to read can be quite challenging, but whatever case you see, read about it. It will help, because it makes you to remember, like, oh, I saw this case, and you tie it. After reading that case, you look at what you're doing for that patient. Is the treatment plan in accordance with the guidelines? So that way you'll be able to marry. In PGY1, being in prelim, you don't do any assessments per se, because it's the categorical internal medicine residents that do their evaluation. I didn't do any. I don't know for other programs. So, but when I got into PGY2, I did my evaluation in February this year. So you do neurology evaluation, and you do it every year. They call it the right exam, the residency in training exam. So that one is what all the neurology residents in the country do at that point. And you know your percentile in terms of your status, what percentile are you ranking among all the PGY1 in America residency, and among all the PGY2, PGY3 I mean, PGY1 in neurology, they call it like it's actually PGY2, but that's when you start neurology actually. So they just still put it like PY or NY 1, but it's actually PGY2 because you don't do anything in PGY1. So, and you're expected to every year to go higher in terms of your score and your percentile. Because if you're still stagnant or you're coming down, that means the whole year went by and you didn't learn anything. So it's like a self-assessment. Normally it should not be used to judge you, but it's to make you feel, okay, these are the aspects of neurology that I am doing well. I'm doing well in vascular. I'm doing well in neuromuscular. I'm doing well in epilepsy. You understand? Okay, I'm not so good in neurocognitive or neuropathology or neuroophthalmology. You are not so good in those ones. But okay, movement, I'm average. It gives you like a basis of your performance and where you can improve upon. I've not done childhood neurology, so I wasn't expecting myself to even, because we do that in PGY3, so I have no clinical exposure to that. So if I score very low, I won't beat myself that much because I've not been exposed to that part. But after doing PGY3 and I still score low, I know that maybe I didn't learn anything from the rotation. So it's a kind of self-assessment. So while you're PGY1, and if you're prelim, try to focus to learn medicine. Because I was asking so many people in neurology then, what can I start reading for neurology? Do I need to start reading neuroanatomy? At least I need to know the anatomy of the brain very well and the nucleuses and all the. And I like try to know medicine this year. Try to know medicine first. We are like Nigerians. Being Nigerians, we want to go ahead, try to know things. But here sometimes they take things very simple and easy, which helps. So you are there for a reason. You are there to study internal medicine. So don't lose that chance. Don't lose that chance. You can read some things that interest you in your neurology whenever you have time, but focus more on knowing medicine, knowing how to manage hypertension, knowing how to manage blood sugar. Those are things they want you to know, because people will come with neurological cases, but they will also have hypertension and they will also have diabetes. So you want to know how to manage your neurology, and it will not affect their hypertension or it will not worsen their diabetes. So in total, the same human beings they are taking care of. It's just different systems, and you can't eliminate one and take care of one. So you have to marry both. So in terms of resources, I usually ask people lots of questions like, okay, you use UpToDate, you use merit questionnaire, you use comprehensive neurology, you use pocket neurology. So many resources are out there. But once I read through one and I feel I don't really like it, the best thing, I just stop reading it. It's better to have 2 books and read it very well than have 10 books. At the end of the day, you just read chapter 1, and all the 10 books. You're reading the same thing, kind of. But you have just 2 books and you like them. You like the pattern of writing of the editor or whoever is wrote the book, and you understand it. It speaks to you. Why not stick to those 2 rather than having too many resources? And at the end of the day, you didn't maximize any of them. That's not so good. That's the way I see it. So stick to 2 very good books and know why you are reading them. If you are reading them to pass your exam, does it cover all the aspects of the exam you're reading it for? If it does cover all the aspects, fine, that's the standard book. And look at the requirements for the exam you're going to write, because one thing is to read for the exam. Okay, you're reading for the exam, there's past questions for the exam. Why not use those past questions? And they ask you, these are the books they recommend. Have at least one of those books they recommend and something else to supplement it. And also ask questions from your seniors like, okay, what book do you use? Was it very helpful? Okay, this one said this one said this. And you try them and you see the one that works best for you and you stick to that. That's very good. Don't, because there's so many resources here. If you're not careful, you just have too many resources and you will not do very well with those too many resources. Because I remember, we all know how we study, so I won't be in the position now to tell you, change your study pattern. You study for step 1, you study for step 2, you know what really worked for you, what really helped you So you have a pattern already. Why not, you know, stick to that pattern rather than overall changing the whole pattern and exposing yourself to something you don't really have much grasp upon.
Oh, thank you so much. I think that's very, very insightful because, I mean, people have, step one, people usually get caught up with almost like eight resources and they get overwhelmed. Focusing on what is most productive for you is very, very good and carrying that into residency. I have two questions for you left now. First question is this: how do you navigate the team communication, like in terms of working with nurses, working with other senior doctors? How do you navigate as an IMG? What are the things, because they are coming to a different culture now, what are the things that you can do to improve that communication so that you don't come in and make some mistakes, like, there's a way they will appreciate you communicating with them, and there's some things they expect you to do. Like, Dr. Nife mentioned something about maybe someone's about to get coffee and you say, can I get coffee for everybody? I know back home in Nigeria, we don't necessarily do that. We don't like go out our way to say, do you want coffee? Like, why are you trying to spend my money? I'm just trying to say, like, it's interesting that what other things do you think can improve communication and make you integrate faster with the team, especially also with the nurses? And then second is finances. How do you manage finances?
Okay. In terms of working with other health workers like the nurses, the physical therapy, the care management, there are so many other people you work with, janitors. I think you study your environment. That's because I can't say this will work for everybody. So you study your environment, you go there, try to be nice. People like people that smile, people that look approachable, kind of, and sometimes you meet people that are very nasty. You can't escape that, like people that just want to be very rude to you. Try to do what you're supposed to do. Once you're doing the right thing, irrespective of whatever anybody is saying, try not to be rude. Try not to, but also that sometimes you have to that sometimes I have to stand my ground. Like, I knew what was being, maybe someone sent me a text message. I saw a text message that was sent to someone. That text message was very rude. She was like, do you know what you're doing? That was the nurse testing the other resident, like, do you know what you're doing? And the person was like, sure, I know what I'm doing. You understand? The person did not make him to vent the anger back, like, okay, what do you mean? Like, sure, I know what I'm doing. And when the person saw that message, well, okay, I just want to be sure that we are cool. And say we are fine. And that was it. But you can send that kind of message to someone else and the person will take it up from there and be like, what do you mean by do you know what? Are you trying to tell me what to do? Or and before you know it, back and forth and everything is... The last one I also saw was, are you stupid? So imagine you saying, are you stupid? What kind of response do you want me to give? Yes, I'm stupid, right? Or no, I'm not. So and the person said, I'm going to end this conversation here now because you're out of line. You understand? And that person immediately apologized, called back, physically came to meet the doctor and was trying to explain that, he was just trying to... For nurses, I try my best to the first thing, don't overlook them. If you overlook them, people don't like that. Like, you want to enter the room to a patient and you just see the nurses at the nursing station and you cannot just say, oh, hi, my name is Stella, I'm with the neurology team. I just want to see Mr. Oh, he's there, okay. And I see this patient and I come back to you and I say, well, do you notice any change? I'm like, they are very helpful. They will tell you a lot, especially if you approach them well. But you see them talking to each other and you just stand, you allow them talk instead of interrupting and say, please, can I? So I was like, what do you mean? Excuse me, I'm still talking. So at that point, you're already, you're not learning the culture. So at first, starting, you make some mistakes. Don't beat yourself too much about it. It's happened to me too. Like, you want to quickly, except the patient is actually dying, that discussion has to die at that point. But if nothing is very you can just be patient for some minutes and And if they keep talking, they don't want to address you, you can just say, okay, I'll send a text message to you, and you go. You've saved some time. You can just send them a text, and they can read the text later. You already tried, so you are covered, kind of. So try to be nice, make them feel they're part of the team. Sometimes when they tell you, oh, doctor, this patient has not made a bowel movement, and you say, okay, I'll give Miralax. And they said, no, she won't drink Miralax. And you don't listen to them, and you put the Miralax. They won't even give the patient the Miralax, and they'll still be start calling you, like, to do what they want at the end of the day. So sometimes you can just ask them, okay, what do you feel we can give? Do you think Senna will be good? I think the patient said she was taking Senna at home, so she will likely take, okay, let's do that. You've addressed that, but you just want to impose your understanding, like, oh, Miralax is good, it works better for me, I use Miralax myself, so the patients will fully understand that. No, it doesn't work. So try to make them feel like they're part of the team. They're very vital part of the team. You're earning less than them, so most of them earn far better than you. So don't feel like, oh, you're still a resident, your fee is very small. And in terms of finances, you talk about finances. How do you manage finances? For me, finances, my husband is also on the work authorization, so he's working, so not so bad, I won't say. But if you're just single, but we also have other things. You're also like spending money for like the family and everything. So for residency, don't expect you're going to be a time for you to save a lot of money. No, it's not going to be a time for you to save lots of money. So try to use that time to I'm being distracted here. So you try to use that time to get all the necessary things you need to do. Invest in yourself. Invest in a good bed. You need to sleep. When you want to sleep well. Don't sleep on the bed that you wake up and you will not feel refreshed. So invest in good bed, invest in good food, try to exercise as much as you can. So things that you like, try to spend some money on it. It will help on the long run. Rather than trying to I try to get very good scrubs, and I find out that even if they're old, once I iron them, they're very good. So try to invest in things that you would need long term. If I don't buy any scrub now, I think in the next 1 year I can still survive, because what I have already bought, especially doing sales, and try to study the American system. They have a lot of sales. So, but don't go to sales without knowing what you want to buy, because if you go to sales without knowing what you want to buy, you spend buying things that you don't actually need. So if you know that Black Friday you want to buy some books, you can just write it down. You want to buy scrub. I never buy scrub except during sales. And once it's sales, I know that's going to get me like 30% off. I can buy. I can wait. Yeah, I can. So try to do that. It will. Then a lot of coupons that they use. So if you can study all those things and discuss with people, it would help you on the long run. So in terms of finance, you may not make much during residency because you want to be comfortable, and but don't make it so tight-fisted that you are not comfortable and you're sending so much money back home, and you're not really feeling relaxed here. So that point, invest in yourself is very, very important for us to.
Well, I think you've made very, very important points, because I remember I saw a picture yesterday that made me chuckle, because it showed a picture of somebody abroad trying to eat sardine and bread and sending money back home, and the people that send money back home are eating mounds of meat. That's a light sound anyway, but it's good, as you said, you need to take care of yourself, invest in what will help you, invest in a good bed. That has to be stated over and over again. Invest
in a good phone. When I came in, I was using
a good phone, yes.
Still using it anyway, but it's my Nigerian phone. This is like Samsung. When I got this iPhone, this was my first time using it. When I got it, I saw the difference. Like, I don't need to go onto my so many things I can do on this very, very small, but like so powerful. So I thought it was a waste of money, but when they were doing a sale, my husband took me there like, oh, you can swap your phone and stuff like that, and you just pay some little money. And I did that, and I saw the benefit. I was like, wow, what have I been wasting? So if I did, I was like, oh, Android is better. I'm an Android person because I've not tried the other one too. When I tried it, I saw the difference and I stick to it. So if you like Android, use your Android. I'm just trying to say invest in whatever.
So little advert for Apple. That's fine. Okay, that's good. Thank you so much. Does anybody have any question as we round up today's session? I think we've had very, very insightful sessions. It's been different perspectives, and it's been very, very rich. Does anybody have any question you could raise? And any questions? I'm going to just stop recording. So the question here says, first question, and this will be to Dr. Stella, is how soon can one spouse get work authorization if it's coming, like I'm coming as a resident now, starting in July. How soon can my spouse get a work authorization?
Because my husband has the privilege to be in the country before me, so he had applied for work authorization in the past and he has gotten it. So he has his documents with them already. So when we came, it was just like a continuation. We went to Canada, then we came to America. So he just wanted to apply again for it. So more like you've had it in the past, now you're applying for it under the J2. And it was quite not so, what time did he get the work authorization? We came in July, because I came in June, like 2 weeks before the beginning of for the orientation and the rest. So he came in July with the children from Canada. So I think he applied immediately when he got here, and I think less than 3 months averagely he was able to get it here.
Okay.
The first may be a bit delayed, but the subsequent one, if SFMG sends the renewal early on. So for this year, he already has the work authorization done since around like February. Already got the renewal that will last him for the next 1 year till June of 2025.
Okay.
So because I was like one of the first person, I already reached out to my academic affairs, like what is happening. And so ECFMG was transitioning to high health. So at that point in time, they were not like giving out the GS 2019 easily. So once they got the GS 2019, immediately we filed for it, and because we have to also renew our driver's license every year and renew the work authorization for him every year. So it's something you have to do, and they give you they give us the paper like in December or early January, and by February, because it's renewal kind of more easier. The first time it may be delayed, but not so delayed, like more than 4 months it should be if you apply early. Yeah.
Okay. I think it's also very interesting. I think Dr. Nife can pitch in now to say that most people coming into residency don't know that we renew visas every year. Like you think it's just like once you get your visa, it lasts you for the next years of the program. So every year you still have to renew your visas. That's interesting. Oh, I see. Okay.
If you want to travel out of the country, you don't need to renew your visa. You can stay. But if you want to go to Nigeria, or you want to have it in case something pops up and you need to go, right? You can renew it. And we usually last time we renewed it in Mexico. You don't need a visa to go to Mexico if you're going for that. If you have American visa, I think it qualifies you to enter into Mexico and renew it. But I don't know why we have to go out of the country to renew the visa. It's something I'm still like, why can't we do it?
That's interesting.
Yeah.
Okay. And the other question I have now for both of you is that in terms of accommodation now, for those that are coming to residency, what platform do you recommend for them to search for accommodation? And do you recommend that they have to make decisions online or have to see it on site? What are the things that, you don't want to get an accommodation where you find out that there's no hot water, there's no eating or something like that, but which platform do you think is trustworthy and they won't scam you? Definitely not Facebook Marketplace, definitely not that.
You want me to go first? Nife, the chief, go first now.
Chief Nisa, do you want to go first?
Yeah, so I don't know if I'm very great with this, but I know there are some like sites like is it housing.com? I'm trying to remember, but maybe if I'll check. Then yeah, I know there's one like that. Then there is like for me, I'm in Philadelphia, so there's this Philadelphia Homes on Facebook, and yeah, so those are like very good places too. Then like your body too in the program, or people in the program too.
Yeah.
There are places where residents live. So these are like first-hand. You're able to get first-hand information, not just what anyone puts on the site. So like for my program now, they created an Excel sheet, and then like residents put where they live, and then they put some of the pros and cons of of where they stay. So and then so I think the incoming residents will have access to it.
Yeah.
So I think discussing with somebody in your program or your program about it too, so you can get some first-hand. Then you could also look online to, I think it's housing.com if I'm not mistaken.
There's one, apartments.com.
Yeah, sorry, apartments.com. Yeah, that's it. That's the one I was trying to remember. Sorry, yeah, apartment.com. Then for like.
If you want to buy a house.
Yeah.
Some people buy houses. I see when I came from Canada, people that came with Canada, they bought houses directly. So some people have the money. So for housing, like you said, I remember internal medicine, they gave us that Excel sheet. But I was coming from Canada, I was like, I was looking at apartments. I was home with my family, so I was like, I wanted to see what Nigerians now. I'm sorry, that's the way. Not Nigerians, me. So I wanted to see where I would stay and how far it is, and transportation. You have to consider so many things. You don't want to stay so far that you are very tired in the morning. And though I can drive, I have my driver's license, but you just have a car. So sometimes I have to like think about how I'm going to transition back home. So that's coming down for the orientation. I stayed in Airbnb for like a week. Within that week, I was able to finalize the accommodation because I already communicating with them already, like 4 or 5 places. I just wanted to come and see what I'm going to get, pay and get the lease. So you can start doing your finding even before communicating with them. They'll show you so many things and everything. And when you come, within that week of orientation, you can just go around and see what you like and also ask from the program. The program people are still the best. I can't tell you, like, I'm in Philadelphia. I can't tell you what will happen in Maryland. So the program you match to, the residents there, they have very good resources for that. They're able to tell you where they stay and how helpful where they stay helps them. And don't go to this area. You start telling you don't go to that area. Most likely don't go to that area. Yeah.
Okay. I think we've answered all the questions. Any other question before we close today? I think we've covered almost everything now.
Thank you so much.
Thank you so much. Thank you so much for coming.
And let's have more of this. So once in a while, so we discuss,
Yeah.
It's kind of nice. You learn from each other. You tell us what you learn in your program and how we can also, I can also learn from you. We're all learning, right?
Yeah, because I think it helps really. I have to manage your finances and all that. Because I think these are things we need to start thinking of. I'm looking forward to seeing more Nigerians on resident faculty boards, program directors. We need more Nigerians and more Africans generally, actually, in all those places, because representation is important.
Very important. Imagine me coming to Einstein and seeing a lot of Nigerians there. I'm very happy. Very happy. I'll just be walking on the corridor and I'll see Biodu and say, Biodu Baomi. That makes me happy. And I'll see, is it eBay? I'll be like, Bia, how are you? And it'll be like, which language are you speaking? It makes you kind of happy. And when you're chatting and you need help from them, you can just say, you understand? If you don't have anybody, then just be. So try to grow your program, invite more Nigerians.
Awesome. But I think we're all very happy. We all have something to say to all our invited guests. Feedback. everybody's trying to talk about now.